One of the approaches to counselling and psychotherapy that's particularly popular at the moment is cognitive behavioural therapy. That is an approach that we do teach to some extent within the mix of approaches we teach in our primary diploma and degree. Many people seek further training in that approach after graduation. The focus of our 5-day professional certificate in CBT is to provide a basic level of skill and understanding for already qualified helping professionals so that they can apply the basic CBT skills, particularly to depressed and anxious clients.
The way that it's taught is that one day builds on the next, and it's taught in a very structured kind of a way. And it provides almost like a map for the therapist, you know, when they're working with the client.
Indeed, helping professionals from other types of professions such as psychology, psychiatric nursing, guidance counselling and so on, are also very interested in learning to use at least some amount of CBT skills and to gain some familiarity with the CBT approach.
So I would tend to find in my private practice, for example, that a lot of GPs are referring clients specifically for CBT, and that would be the kind of the feedback as well, is that, you know, often therapists are kind of wondering what is it all about, and, you know, they want to get that good grounding in it. I suppose it's researched, it's evidence-based, it's proven to be effective with a lot of various different issues.
There are many myths about cognitive behavioural therapy. Perhaps the main one being that it can help everybody in double quick time. What can be said perhaps about cognitive behavioural therapy is that if you only have a limited amount of time to work with a client, and that often is the case, that cognitive behavioural therapy will mainly focus on some of the pieces that perhaps are amenable to change.
By the end of day 5, they're not CBT experts, but they certainly have a really good foundation. I suppose one of the skills that they would be taught is an introduction to case formulation, which is like a theory or a hypothesis about the client and what's happening for them, and kind of putting the pieces of the puzzle together. They would learn a lot of kind of the classical CBT interventions, so cognitive restructuring, challenging negative automatic thoughts. They would learn a lot about the behavioural interventions, which is a really interesting part of CBT, where you can get really creative, and it's the bit that I'm really passionate about, I suppose. So they would learn exposure and response prevention, so in the treatment of OCD. They would learn how to design a behavioural experiment. So all sorts of the key interventions, I suppose. Then each participant, I suppose, has an opportunity to go away before the integration day, and the requirement is 20 hours client work, applying the CBT approach. And then it's nice then, because you come back and you do the integration day at the end, and you talk to your peers and colleagues about what it was like applying the approach to your client work.
We found this to be a particularly productive learning methodology, and the feedback on the value and intensity of the integration day has been very, very positive. It's quite a unique opportunity, according to a lot of participants, in the sense that once you're a qualified therapist or qualified in other helping professions, you don't necessarily get a lot of opportunities to reflect in that way on your work and to hear other people reflecting in that way on their work.
It's the theory, but it's the practical side as well, so the two kind of are combined to give you a kind of a really good foundation.